Hi, I'm Frank Spear. I want to welcome you to this blog. This is part 4 of our ongoing series on anterior temporaries. And in this segment, we're going to talk about the gingival embrasures, how to carve them, and exactly what we're trying to achieve with them. Now, I'm going to start by actually showing you sort of what we don't want. I took this photograph out of a national publication that came to my office. And the author was making a point about how when you remove temporaries, often it elicits bleeding that's very hard to control when we're trying to bond restorations. What I want you to look at is in fact the gingival embrasures, or more correctly the lack of gingival embrasures in this temporary. There's no way with a temporary that has embrasures like that you're not going to have inflammation and bleeding. And when this temporary comes off, you can see how irritated that interproximal tissue is between those anterior teeth. And the author went on to show how he tried to control that bleeding, but he showed spot curing the restorations in place. And I want you to look at all the hemorrhage up around the gingival area of those restorations. There's no way you're going to get predictable bonding trying to bond in an environment like that. Let me show you what I'd like to see in terms of gingival embrasure form. This is a temporary on a set of veneers I'm doing. It's fabricated indirectly on a stone model. But what I want you to notice is every single gingival embrasure is slightly open. I always want to leave a slight gingival embrasure opening in my anterior temporaries because they're always made after we've done some form of displacement to get our final impression. Whether you did it with a laser or electrosurge or a retraction cord, you've distorted the tissue some for your final impression, and then you make your temporary. Your temporary is basically an impression in acrylic of that distorted tissue. So when we carve our gingival embrasures, we want to leave an opening for that tissue to heal back down into. Here you can see what that temporary looks like when it's tried in, and there's actually a small opening in each place. Now we go ahead and cement it. This is all the day of the final prep and impression for this case. But take a look at the temporary 8 weeks later, and the tissues come right down into those openings exactly like we want it to. Now, not only are the papilla healthy, but the gingival margins, what we went through in our last video, also should be good because they fit well. And this is what the teeth and the tissue look like when that temporary is removed. No inflammation, no bleeding to deal with, makes the whole bonding process much, much more straightforward. So what I'd like to do is walk you through how I carve those gingival embrasures. I do it using an ultra thin diamond disc. It's called a 911H. I use one from Brasseler. It's double-sided, it's very thin, and it's very flexible. The key to carving gingival embrasures is to always keep the disc angled so it parallels the tooth you're working on. And so you'll notice how these discs are angled over towards one tooth, the central or the lateral. Same when you look at it from the facial. Now this happens to be the set of veneer temporaries that in fact was the case you saw a minute ago, but I want you to see that whether it's full crowns or veneers, the disc angulation is the key. It's a very thin diamond disc run at a fairly slow speed. And what we really want to think about is we're always trying to keep that angulation so it then flows into our interproximal, our facial embrasures and incisal embrasures. What we want to avoid is coming in with the disc like this. If we come in with the disc straight, we're going to be cutting a concavity into the facial surface where there shouldn't be one. So let me just walk you through a video, and you can actually see me carving the temporary that we had started to work on in the previous segments. Notice how I tipped the disc back and forth, and I've marked the margins interproximally with a red pencil, and I'm basically just cutting right along that red pencil line with the disc running at a very slow speed in an electric handpiece, a very sharp disc. And so I drag it along the lingual margin, drag it along the lateral, go over and do the same exact thing on the opposite side, lateral and central. And then probably the one tricky area is the midline, because what you really want to do when you get to the midline, which will be out here in just a second, is we want to make our initial cut right halfway between the roots of the two central incisors. So there we're finishing up the embrasure between the lateral and central on the opposite side. And now let's go ahead and we'll get to the midline embrasure. And you'll notice what I'm doing. I'm going to notch it so it's right halfway between the two centrals. And now from that notch, I lean my embrasure over and carve it back to the margin. That's how I get a nice symmetrical embrasure form between the two central incisors. If that embrasure is closer to one central than the other, you get a very asymmetric looking area. And then you come in, you do the same thing on the lingual surface. And basically now our gingival embrasures are completed. And you can go up the lingual to open that lingual embrasure up. And what's left in terms of trimming this temporary will actually be the incisal embrasures and the facial embrasures. And that's what we'll be covering in the next segment, is how do we carve that incisal embrasure and facial embrasure. But what I want you to notice is in the final temporary, notice the symmetry and form of the gingival embrasures, all put in with that ultra-thin diamond disc. Now when you do videos, you can tell how long it takes to do things. And so how much time did it take me to carve those gingival embrasures? That video was 1 minute and 46 seconds long. Once you learn how to do it, it's easy to do, it's fun. Your assistants can learn to do it very well, but it's huge in terms of tissue health for your patients. So I hope you've enjoyed this segment, and I'll look forward to seeing you soon.